There's a saying that I always use, it's do it right the first time. If you need to have a surgical procedure, it's in your best interest to research the top surgeon in your area that does that particular procedure. If you look at a general dentist is more of a jack of all trades. Some general dentists may be proficient at doing implants, but what if something goes wrong? What if your case ends up being a little bit more complex than anticipated? That's why you want to be under the care of a specialist. For instance, if I needed a heart valve replaced, I'm going to go to the doctor that does a heart valve replacement every day. You become more skilled and more proficient if that's all you do all the time. I do bone grafting and implant surgery all day, every day. That's what I do. We often compare our office to the TV show Botched. It's about two plastic surgeons in California that try and fix up mistakes that were performed by other doctors. And I can tell you one thing, when it comes to dental implant surgery, you don't want to get botched. First of all, you need to determine if you're seeing a general dentist or you're seeing a dental specialist. I find that many patients are confused with this. They'll often come to me and say, well, I already saw a dental implant specialist. And they'll tell me who it is, and it turns out it's a general dentist that does implants. Realize that any dentist can do dental implants. They can take a weekend course, they can open their office Monday morning and start doing implant surgery. A dental implant specialist, however, the training is different. It's a full-time program in a focused area of dentistry. It takes at least 3 to 6 years to become a specialist, and that's after dental school. I went through 7 years of training after dental school. I did 2 specialties, one in oral maxillofacial surgery and the other in prosthodontics. Oral surgeons and periodontists are specialists in implant surgery. A prosthodontist is a specialist in fabricating implant teeth. Another question that I think it's important to ask is, are you board certified in any area of dentistry? Now realize that all dentists must go through a basic dental board exam to be able to practice in a state. However, board certification for a specialist is different. Not all specialists are board certified. It requires going through a very rigorous oral and written examination. I have 2 board certifications. I'm board certified in oral maxillofacial surgery, and I'm board certified in implant dentistry. I think the last thing you could do is do a Google search of the dentist. You can look at their reviews, you can see if they have any professional affiliations, you can even see if they have any discipline from the Board of Dentistry. I think it's important that a patient does their research. If something doesn't sound or feel right, get a second opinion.